Hello and welcome to the Armor Men's Health Show. I'm Dr. Mystery, your host, and joined as always by my wonderful co-host, Donnelly.
Hey, everybody. Thank you so much for joining our show and for sharing it with all of your friends.
Donna is a professional comedian. She is the former office manager and business development officer here at NAU Urology Specialist. That's the company that brings you this show. I'm a board certified urologist, and we talk about all the issues between the nipples and the knees.
I got demoted already. I'm the former this and the former that,
You were the
but
former office
but
manager.
I'm the current co-host.
You're the current co-host.
That's right, where you can find me right here at NAU Urology Specialists.
Donna, when people want to become our patient, how do they do that?
They call us at 512-238-0762, or they can visit our website, of course, armormenshealth.com. You can check out our old podcast there. You can also send your questions in, submit a question button right there at the top right, and we will answer your questions anonymously. We're in Round Rock, North Austin, South Austin, and Dripping Springs, Texas. We're in Central Texas, Dr. Mystery. Lots of people coming in from all over the country, but we are in Central Texas.
We are indeed, Donna. The questions that our listeners ask really drive this show and our podcast and everything else we're doing. Do you have a question for us?
I do. This one, we're a little behind on questions. This one came in a few weeks ago, and I thought it was really intriguing. It's short, but it's really good. Dr. Mystery, if you're suspected as having prostate cancer, why is it better to have a biopsy than a PET scan?
It's a great question. We get the diagnosis of elevated PSA is a very common diagnosis that we get, and this is what a urologist does. They evaluate your risk for having prostate cancer. They give you an idea of whether or not you're going to have this disease process. And then we're going to have to figure out what the best way to diagnose it is. Now, in cancer, you have to have tissue. That's almost true of almost any cancer. In urology, we don't get tissue prior to removing a kidney tumor, but almost all other tumors that we want to get some tissue to understand what the diagnosis is.
Okay.
And when it comes to prostate cancer, the only way we can get tissue is through a biopsy. What this listener is asking is, why can't we just do some imaging test to diagnose it? Well, I guess I would ask that listener, and I'd ask all of our listeners, would you want treatment if you didn't have a disease? Would you want any degree of uncertainty?
Right.
So when somebody's referred to us for an elevated PSA, this is just a blood test that looks for your risk for having prostate cancer.
Mm-hmm.
Now, that risk can be about 40% if your PSA is high. We want to know if your PSA is high for anyone, which is a level over 4, but we also want to know if that level is high for your age. If you're younger, that number should be lower. If you're around 50, your PSA should be around 2.
Okay.
In our office and in my practice, we get an MRI of the prostate. The MRI is done at a imaging center. It does take about 30 minutes to an hour where you're sitting inside that machine that clangs really loud. That's what an MRI does.
Mm-hmm.
It's often covered by insurance. But in our practice, it doesn't decide whether you get a biopsy or not. It just tells me if there's an area of the prostate that I should target when it comes to where the biopsy is done. And we do what's called an MRI guided biopsy here in the office.
Mm-hmm.
So the MRI can give us some information as well. What this patient is talking about, I think they're probably confusing an MRI and a PET scan is what I think this listener is doing. But there is a PET scan for prostate cancer called the PSMA PET scan. Now, this PET scan looks for prostate cells, not prostate cancer cells, but prostate cells that could be outside of the prostate. And that suggests that the cancer has spread somewhere. If you give it to someone, even if they don't have prostate cancer, the prostate's going to light up because it's looking for prostate cells, not for prostate cancer.
I see.
And so that's why a PET scan is not a very good diagnostic tool just for general prostate cancer, because it's going to light up the prostate too. So what this listener is trying to do is trying to avoid a biopsy. And I know why.
Because
This
it's yucky.
This is
It's
uncomfortable. This is uncomfortable.
Yeah.
You're going to have a situation where a probe is put into your rectum and a needle is placed through that probe through the rectal wall into your prostate to do a biopsy. That's how the
Oh,
vast majority of the biopsies that I do are performed.
that made my prostate hurt.
That's
Mm,
right. That's
mm,
right. Now, women go through much worse things. If you have a
mm,
breast tumor on an ultrasound, you get a needle in your breast. If
mm.
you have suspected uterine cancer, you get a brush in your uterus. I mean, it's not great to have it, but
Right.
you know,
Necessary.
hundreds of thousands of men get this biopsy done every year. There is a way that we can do the biopsy, not through the rectum, but through something called the perineum, which is your taint, that little skin that goes between your rectum and your scrotum.
I have a question.
Yeah.
Are the patients awake during the biopsy?
Yes,
Or
during the transrectal biopsy, you are generally awake. We give you a little Valium. A lot of offices don't do that. But, about half of our patients, because they want to drive themselves to and from the biopsy, won't do the Valium, which is fine. I mean, they get through it just fine. Uh, if the transperineal biopsy, where we go through the taint, takes a little longer, it might hurt a little worse, and you have to make sometimes more than one stick through the skin. So those patients we do give a little bit stronger of a sedative to. And in our office or in our practice, we currently do that in the operating room. So that can add some expense and some logistical problems, issues when you're trying to, get it done in the operating room.
why don't they
But
get a medication like you do for the vasectomy, the Versed medication? I'm just
that's a
curious.
great question. They don't need it. I mean, most of our patients
Oh,
don't
it's
need
over
it.
fast.
It's over pretty quickly. I can get a biopsy done in less than 2 or 3 minutes. But
I
if
see.
you request it, not only can we do the biopsy with oral Valium, we can also do it with IV Versed, and in some cases, we can even do it with propofol, which is the medication you'll get during a colonoscopy.
Yeah,
Eh.
that sounds like fun.
But the vast majority of our patients do fine without it. I always put a camera in the bladder through your penis at the same time, called a cystoscopy. Some of my partners here and some of the people in other practices do not do that. I like to know what's going on in all of your genitourinary anatomy if I'm going to operate on you. The biopsy results come back in a week. And the answer for this listener, why we don't just do imaging, is because the imaging is wrong often.
Mm, okay,
And
that's
I had a
fair.
patient very aggressively tell me the other day that he thought that I was doing the wrong thing by immediately going to a biopsy after an elevated PSA. He's
Oh,
61. His brother died of prostate cancer.
oh,
He's got a father with prostate cancer, and he came in with an elevated PSA test. He came in and saw me, agreed to do a biopsy, and
yeah.
then said that I was too aggressive to do the biopsy. And
Wow.
what I explained to him is what I'll explain to all my listeners. My job is to find prostate cancer. That's my job. My
Right.
job is to save your life. If you want me to be someone who is just kind of generally discussing the science of the issue, then we can read a book together. But my job is to save the 61-year-old who I think may have prostate cancer. That's my job. So I'm here to give you the advice that I think is most likely to diagnose your cancer early. Then you have the information. That's why you get your air conditioner maintained. That's why you get your
Mhm.
car maintained. This is part of screening and maintenance, trying to find problems early so that your life can be saved.
You would
And
think his brother dying that he would want you to be a little more aggressive.
you would think, but maybe he didn't like his brother. I don't know.
Oh, mm.
And
Mwah,
when it comes to the when it comes to your own body, oftentimes we don't want something very invasive or aggressive. And I see it all the time.
sure.
Patients will be diagnosed with the disease and they'll be like, well, doc, what if I don't do anything and I just live with it? Well, you live with it, you take the risks.
Mm.
But their family's like, no, I want you to cut this man in half so he can stay around, forever and ever. And so what we choose to do to ourselves is different than what we choose to do our family members. And that is part of what we navigate. Now, even though I may advise a biopsy, if you choose not to do a biopsy, I'm not going to cancel you as a patient of mine. Of course not. Now I'm going to give you everything I can. If I think you have cancer, you're going to see our health coach and try to do dietary and lifestyle modifications to reduce your risk. If you have a PSA that's high, but you don't believe it, or you want to get an MRI to give you some information before you make a decision, then we can
Mhm.
order that. We also do other tests that can give us some information. Our favorite test today is called the 4K OPKO score, which uses a different kind of PSA to better understand your risk. So we are going to work with you to get the information you need to decide whether you need a biopsy. But
Mhm.
for this listener's sake, you know, the truth is in the tissue. We need to know what kind of cancer you have, how aggressive it is, where is it in the prostate, and that can help us guide your treatment better.
That makes
Donna, how
sense.
do people become patients of ours?
You can call us at 512-238-0762 or visit our website, armormenshealth.com. Remember, our podcasts are wherever you check out free podcasts, and be sure to share them with your friends. Thanks so much, Dr. Mystery.
Thank you, Donna.